Ryan, good morning. Always great to have you with us. So lawmakers remain deadlocked more than a week into this shutdown now, continuing to point fingers, blame each other, each party saying it's the other's fault. Now, the Senate keeps voting on competing funding bills, doesn't have support in the chamber. Where are we at this point in terms of ending this shutdown? Any sign that there is going to be some bipartisan agreement?
No. That's the short answer, Savannah.
Thank you, Ryan.
I mean, they really have not made any progress. I mean, there are these kind of sidecar conversations with some bipartisan lawmakers. There was a dinner last night, but none of it has reached the leadership level. The two sides are very much entrenched in their previous positions that basically got us into this shutdown. The only thing that I would say is even slightly different is that prior to the shutdown, Republicans weren't even interested in talking about health care in any sort of meaningful way. You're starting to see the slow creep of them introducing a health care argument into the conversation, but they're still insistent that that real negotiation can't happen until after the shutdown ends. So we're still basically in the same place we were before this whole thing started.
And perhaps the Republican who's talking most about health care is Congresswoman Marjorie Taylor Greene. Has been very vocal about her concerns during the shutdown and those premiums going up. We mentioned yesterday how she seems to be breaking with fellow Republicans when it comes to this issue. You actually spoke with her one-on-one. What did you learn?
Yeah, it was a pretty wide-ranging interview, Joe, and if we thought that she was going to back away from those comments that she made on social media from the night before, we were definitely wrong. She doubled down. She truly believes that her party is handling this situation incorrectly. She believes that health care is a real crisis in this country, and the time to talk about it is now. Listen to what she told me.
This is the #1 issue I hear about in my district. Health insurance premiums are unaffordable, not only for people on the ACA, but also families, maybe small business owners that buy their own health insurance. And with the cost of living today, I think it's reached a boiling point. I am personally against the government shutdown. I really want to be doing appropriations. I believe in that process. That's our job, bringing taxpayer dollars back to our districts that help our communities, roads, water projects, you name it.
And a couple of other ways that she's breaking with her party on this particular issue. She disagrees with Speaker Mike Johnson. She thinks the House should be in session right now negotiating this issue. She also thinks that the Senate, if they can pass judges with a straight party line vote, should also be able to vote on a straight party line vote to open up the government, suggesting they should go nuclear, as it says, and break the filibuster to get the government back open.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.